Hello, this is Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about toe fractures. Toe fractures are very common, and it is widely assumed that toe fractures are usually no big deal and that there's nothing you can do about it and they'll eventually heal on their own. Well, usually this is the case, but not always. Each toe has 3 bones in it, with the exception of the big toe, which only has 2 bones in it. Each one of these toes can potentially get fractured by a number of different means, including kicking something, having an object drop on one of the toes, which can cause a crush type injury, as well as numerous other things that can occur that can cause these fractures. These toes, in and of themselves, do generally tend to heal quite well, with the exception of fractures that move out of position and cause the bone to stick out in one direction or the other. When this occurs, especially when it occurs along where some of the joints lie in the toe, this can cause some long-term issues with arthritis of the toe, as well as create potential prominences against the skin by the bone pushing against the outer skin, which can cause painful corns to form eventually after time. Now, if a toe fracture has not moved out of place and it just simply has cracked through the bone and has stayed put, then it's fairly easy to treat. All one needs to do is to splint the fractured toe to the toe next to it to keep it stable and allow it to heal. This healing process will take approximately 6 weeks. However, if the fracture has moved and splintered off in one direction or the other, which could include side to side or even up and down, then this fracture needs to be seen by a medical professional who can either, after numbing up the toe, pull the toe back into place and move the bone, or occasionally have to operate on the toe in order to fix the fracture and replace the bone back down onto its normal position. There is one instance in which there is a fairly dangerous fracture that needs to be looked out for, and that's a fracture that's associated with bruising on the toenail itself. What can happen in these types of injuries is that you can either drop an object on your foot or you can kick something, and this would cause the end bone of the toe to fracture. Now, occasionally, sometimes a splinter of that fracture can stick up through the skin and actually cause bleeding in the skin tissue underneath the nail. This is an open fracture, and this is a fairly problematic situation, and that infection can get into the bone and can cause a very serious problem. Anytime you injure your toe and think that you may have had a fracture and notice that there's bruising in the skin underneath the nail, this needs to be looked at right away. Also, if you don't suspect that you had a fracture but just notice that the entirety of your toenail has become bruised and your toe is sore, that also needs to be looked at, because that could still indicate that a fracture has occurred. Sometimes toe fractures don't feel like what one assumes a toe fracture would feel like. They're not necessarily as painful as one would think, and the bone may be fractured even though it doesn't feel like it. Well, I hope you've enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.